So, what does a nurse really need in their toolkit to make it in the 21st century? It's about way more than just clinical know how these days. We're going to dive into the essential digital skills every modern nurse needs, and we're looking at it all through the eyes of an experienced educator who's seeing it firsthand. Let's start with this puzzle she noticed with her own students. This one sentence, right here, just perfectly captures the strange paradox. You've got a whole generation of nursing students who grew up with phones in their hands. They're total digital natives. But then, when they're faced with the actual tools of their profession, they freeze. So why is that? Well, this lays it out beautifully. Think about it. The world of social media is designed to be easy, intuitive, public, and pretty low stakes, right? But a clinical system? It's the complete opposite. It's complex, it's governed by super strict privacy laws, and it's incredibly high stakes. I mean, one wrong click can have huge consequences for a patient. Of course they hesitate. And that hesitation, it points to a really fundamental gap. This isn't about them being bad with computers, not at all. It's about this massive space between knowing how to use a device and truly understanding what you're doing with it. So the real issue here is just uncertainty. When a student is charting a patient's vitals, they aren't just plugging in numbers. They're creating a permanent legal record. And in their head, they're asking, who's going to see this? Could this end up in a research study? How is this going to affect billing? This is exactly why a totally new kind of literacy needs to be baked into nursing education from day one. And the solution isn't just, more software training. It's about completely reframing these digital skills as a core clinical competency, something just as vital as taking blood pressure or giving meds. And that competency actually has a name: Critical Digital Literacies, or CDL for short. Now, this isn't about being some tech genius. It's about being a critical thinker who can look at digital information and deconstruct it. Who's behind it? What are the biases? And how could this affect a patient's real-life health decisions? Now, here's where it gets really interesting, how this all plays out in the real world. An educator shared a story about a patient who came in terrified, absolutely refusing a recommended treatment, all because of a viral video they saw online. All of a sudden, that nurse's job wasn't just about medicine anymore. It was about helping their patient navigate a whole sea of online misinformation. And back in the classroom, this is how they teach students to handle it. They learn how to break down that viral video. Who actually made it? What emotions is it trying to make you feel? Why did the algorithm push this to this specific patient? And then the most important part, how do you guide that patient back to evidence-based care with real compassion? That's a clinical skill right there. Okay, let's move from the online world right to the patient's bedside and see how this all connects. Because this isn't just about what patients see on the internet. It's about how nurses themselves are handling data, upholding ethics, and keeping that fragile bond of trust intact in a digital world. Just think about it for a second. A nurse walks away from a computer without logging out. Another one shares a screenshot, with the name blacked out, in a private group chat to ask a question. These little habits feel so minor, so harmless, but they can lead to massive privacy breaches and just shatter that foundation of trust with a patient. And it all brings up a huge question that honestly every single one of us should be asking. When a nurse enters our data into that electronic health record, where does it really go? The answer? It goes everywhere. It plugs into what experts call an ecosystem of connectivity. That single data point doesn't just sit in a file. It can be anonymized and used for clinical research. It gets pulled for insurance claims. It's fed into algorithms that can predict disease outbreaks, and it can even help shape public health policy. So suddenly, a nurse isn't just charting vitals. They're contributing to this massive, interconnected global system. And once you realize that, it completely redefines the role of a nurse. It pushes it way beyond the four walls of the hospital. Their everyday digital actions can have local, national, and even global consequences. This isn't just a new agey idea, either. It's actually backed up by formal frameworks, like the OECD's Global Competence Model. All that really says is that modern professionals have a responsibility to act for our collective well-being. So when a nurse charts data with precision or figures out how to conserve resources, that's not just a task on a checklist, it's an act of global citizenship. And we can see it in action. An educator talked about leading a simple sustainability project on her unit, just to reduce medical waste. And by making more mindful choices about supplies, the team seriously cut down on their environmental impact and costs.
It's such a powerful reminder that individual nurses really can drive huge systemic change. This modern toolkit also has to deal with mental health. I mean, digital tools, from meditation apps to online support groups, can be an absolute lifeline for patients and nurses. But they're also a double-edged sword, right? They can blur the lines between our personal and professional lives in ways that can be completely draining. So the key takeaway here is we need a new kind of emotional intelligence for this digital age. Let's call it digital empathy. It's all about recognizing when a patient is feeling overwhelmed by what they're seeing online, knowing how to set boundaries to protect your own mental health from technology, and always putting your patient's privacy first in every digital interaction. Okay, so what does all of this add up to for the future? It means that nurses are in this unique position not just to react to technology, but to actually become leaders in how we use it to care for people. At the end of the day, the goal here isn't just teaching nurses how to use the next shiny new app or software. It's so much bigger than that. It's about empowering them to actively shape a future where technology serves care and compassion and ethics, not the other way around. As the source material says so perfectly, when we integrate these literacies into education, we're building a generation of nurses who don't just adapt to the future, they're the ones who are going to lead it. And that leaves all of us with a final, really important question to think about. In an age of algorithms and big data and virtual everything, what does it truly mean to provide human, compassionate care? That's the challenge, and that's the opportunity for the modern nurse.